Welcome to Health Talk. I'm Dr. Gloria Wu. Today we have with us Veena Nam. Our topic today is how to take a correct pulse. We created a teaching tool device. First, let me tell you about the problem. Many people have problems with their heart and it's all diagnosed by pulse. Pulse is part of the vital signs and they go to their doctor's office often if they have atrial fibrillation, sinus bradycardia, all these fancy terms meaning that their pulse is either too fast, irregularly irregular, or too slow. And for nursing students who are taking a licensing exam or EMT specialists who are taking a licensing exam, pulse is so important. It tells us so much about the person's heart condition and their lungs and general health. So to this end, we created a device which has a light-emitting diode to make a beep to match the person's pulse. So first she's going to take my pulse and then she's going to take that for 15 seconds, multiply that number by 4, input that in using this button so it'll say whatever number it's going to say. Then she's going to hear the beep or see the light emitting diode and then retake my pulse to verify that this is a correct pulse. So we're going to do a demonstration, and we think this is very important because many people exercise, they want to know what their pulse is, especially if they have a heart condition, or athletes who want to know they're doing interval training correctly, or people in nursing homes and their parent and their family and family members are worried whether their pulse is right. It's thready. Grandma's pulse is thready. You can't feel it. Or if you're very, very thin, you cannot feel it. If you're very little chubby, you cannot feel it. And so all these things are important. Or if the pulse is irregular, people have a pacemaker. And so we just want to go through how to take it correctly. So here we're going to have Veena take my pulse.
So I'm going to take Dr. Wu's pulse for 15 seconds. I'm going to turn on the timer and measure it for 15 seconds. Okay, so her pulse is 15 and I multiply that by 4. Now I get 60 beats per minute. And
so she's inputting that.
Mm-hmm.
And there's going to be a light-emitting diode.
Yes. So here's a light-emitting diode, and I compare that with Dr. Wu's pulse. Yes. So it matches. So this pulse will tell us whether her pulse is normal. It says N here. So Dr. Gloria Wu's pulse is normal.
Now, on the other side of the device, here it is B for sinus bradycardia, normal, tachycardia, and warning. So the same thing is here. Green is normal. Red is if it's less than 52 beats per minute or greater than 120. And this is warning if it's approaching that. And so you can see this enlarged here. And this is useful, we think, for teaching people how to take the pulse. In my office, I used it to train some of my medical assistants who already had training and graduated with a certificate of medical assistants, and it was very useful. Now, all these things are important because if your pulse is slower than what your doctor thinks it should be, you should call him. And it's important to say that the pulse that you've taken is reliable. So that way you can tell him over the telephone, my pulse is 50, and last time, doctor, you said the pulse was 60. Or I feel a sudden palpitation, I feel short of breath, and my pulse, I can't feel it, but then I tried this device and I found it to be 110, and I understand that my pulse is usually 70. Should I come in to see you? So this is very important. And it's also important for people who are doing interval training, who are athletes, because they want to raise their pulse from 60 to 120 when they're training, or if you're trying to lose weight and you're doing pulse-like training, run for 1 minute, walk slowly. And so all this is important information for you to have for yourself to kind of self-test, maintain your health, and stay at home and be healthy. If you have questions, you can go to our email, correctpulse@gmail.com. Thank you very much for listening. Welcome to Health Talk. Today we're going to talk about Android apps that are useful for health for you at home. We developed an app called iWorkout 101, and we based it on vision, the OKN, Optokinetic Nystagmus, and we felt this would be good for people with a problem with their eyes. They lost central vision because of diabetic retinopathy or permanent visual loss from age-related macular degeneration, which is one of the leading causes of blindness after age 55 in America. And we felt that we would train other parts of the brain to see. Now first, optokinetic nystagmus is basically this testing people's vision using a tape, a black and white tape like this. We use this in infants who are just born, premature infants, stroke patients, non-verbal adults. Now, this tests your vision by kind of exciting a primitive reflex in the middle of your brain. So if you imagine a line through the middle of your brain, this is the area that it's going to test. And if it works, that means the person has a connection from that part of the brain to the occipital cortex. So we're going to demonstrate this on one of our devices. This is a tablet. And here's the OKN tape. And I'm going to look at it, and you'll see my eyes beating. So usually my eyes will move right and left smoothly, but when I do this, it's going to beat and stop, have a saccade. So it's going to beat, 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 beat. So I'm going to demonstrate. Okay, so I'm going to look. And so you should be able to catch that, the home audience. Now, Agastya Gupta is here and Don Kim is here. Agastya wrote the program for this and this software program. Now tell us a little bit how you wrote this and what the response has been.
So I chose to write this program in Java because it's compatible across multiple platforms. So this will work on your PC computer and your Mac computer and your Linux computer. And also, roughly 2 months ago, we also released an Android app which can be found on the Google Play Store under the name iWorkout 101, and the response has been amazing. We've received over 500 downloads and great reviews.
Now, show us the second part of this test. So here would be the OKN button. So you press the OKN button, and that's the tape that we just saw. And then there's the dot part. And this is where you can see these dots appearing, and I'm going to point to them, and it's going to time my response. And you can practice with this and see if you can get faster and faster. Now, traditionally, when there have been Android apps or self-tests at home, we use something called the Amsler grid. This Amsler grid is very static. You cover one eye and you look at the center dot and you want to see if there's anything missing or the lines are not aligned. And this tests vernier acuity so that everything should be aligned like this. If it's off like this, then there's fine visual acuity loss. So this test actually tests more function, whether the person actually sees, so it's interactive. You'll see the eye beating, and you can also practice your quickness in the vision of the dots. Agastya, tell us more about how you created it with Java and you used your own language rather than using pre-made languages.
Right, so this program was built directly into Java. Most people or most guest developers use pre-made game development suites to create it, but I just chose to develop it directly into Java so it would be more stable overall.
And we also have it on the phone, the Android phone, and Don Kim is going to show us.
Okay, so this app is also available on the Android smartphones. So what you need to do is first download it, and then instead of holding it vertically, you need to hold your phone horizontally because it'll be a bit faster that way.
And then you can also get the visual dot part.
Right.
So it's impressive. In 2 months we have over 500 downloads, and we had a certain number that kept the downloads. How can somebody in the home audience go to Google Play to do this?
So it's fairly easy to get this this little device. So you would just head to Google Play, and in Google Play in your device there'll be a little search bar, and in it you can type iWorkout 101. So that'll be EYE Workout 101, no caps, no spaces, and that'll be the first app there. And the icon for this looks like a nice blue eye on a gray background. So it's pretty easy to get the app.
So if you have any questions, you can email us at iworkout101@gmail.com, and we're really happy to answer any questions. Thank you. We're going to talk about apps for the home user for your health, and this is targeted for the diabetics and people who are worried about diabetes and people who are family members of people who have diabetes. Diabetes affects 26 million Americans. 1/3 of those people do not know they have it, and 79 million people in America are thought to have prediabetes. And we looked at diabetes and fast food, and we thought about how many diabetic patients have to eat on the run. Let's say they go on a business trip, they're stuck at the airport, they must do something and eat because otherwise they starve on the airplane since the airplane stopped feeding people. And so we created diabetes and fast food. Our software developer, who isn't here today, is Stephanie Tang. She's a Stanford University student, and she used Java. So in diabetes and fast food, you can download this on Google Play, and you just type in diabetes and fast food. And we took the 100 most common fast food things that people order. We found this on Google search engine. We averaged the top 4 restaurants that sold it, and used their serving size. So an average serving was sometimes 12 ounces for a hamburger or 10 ounces. Then we would average that. Then we would calculate the calories, and then we also figured out their glycemic index. So show us on the, it can be found on the, you can do this on a tablet and also on the smartphone. We happen to have a Samsung smartphone right here. And it asks you to put in your age, your weight, your height. It'll calculate your body mass index and also correlate it to the World Health Organization to see if you are appropriately normal, obese or not, and how at risk you are. So this is really for people who are thinking about diabetes, who are pre-diabetic, and we found out that if you eat a McDonald's hamburger, it's not as bad as you think, and so that's very useful information. Now, we also thought about Asians and the metabolic syndrome. As we know that metabolic syndrome, discovered the year 2000, it used to be called Syndrome X. It affects Asians more than Caucasians, and that if you have the 5 risk factors, such as high blood pressure, even though you're treated, high cholesterol, even though if you're treated, high triglyceride, high fasting blood glucose, high hemoglobin A1C, or for males, a waist circumference greater than 40 inches, and for females, waist circumference greater than 35 inches. If you have 3 out of the 5 risk factors, or 3 out of these risk factors, you have the metabolic syndrome, or you're at risk for the metabolic syndrome, and therefore you're higher risk for heart disease and diabetes. So to this end, again with Stephanie Tang being our software developer using Java, we created this app called Asian Diet Watch. And Veena Nam, who is a graduate of the UC Berkeley School of Engineering, we compiled the list of the 100 most common Asian foods, and we used the standard restaurant serving. And tell us how we can find this.
So you can just go to Google Play and type in Asian Diet Watch and download the program. It looks like this.
And this is the icon?
That is the icon.
So here's the icon that you'll be seeing.
And when you click it, you will going to enter your age and whether you're female or male, and your height and weight, and how active you are. And this will give you 100 list of common Asian Asian foods. So if you click Chinese food, here are all the lists. And if you click Japanese food, here are all the lists.
There's more also.
Yeah, and there's Korean and Vietnamese. Yeah.
And so far we've had over
450 downloads.
And we're the first and only Asian food list menu for diabetics.
Yes.
On the internet, and the only one for all the Android smartphones and the Android tablets. And you can email each of us or both of us, and you can target which one you're interested in for the emails. You can type in Asian Diet Watch at gmail.com or diabetes and fast food at gmail.com, all one word. And you can write us comments if you like it. Thank you for joining us. Welcome to Health Talk. Today we're going to talk about inventions that are good for you, for your health, for people at home. And I want to talk about the glaucoma test ball. Agastya Gupta and I developed this ball because we felt that there was a big problem. And one of the problems is glaucoma is the leading cause of blindness of all ages in America. And in the world, it is maybe not number 1, because number 1 is cataracts, but it's up there like number 2 or number 3. And Agastya being South Asian and me being East Asian, we have small eyes. We don't need glasses. And we're more at risk for angle closure glaucoma than Caucasians. And this condition means that your eye pressure is high, higher than normal, which is 10 to 20 millimeters of mercury, and that the high pressure means my eye feels hard, and that I will have nausea, vomiting, and a severe headache, the most severe headache in my life. And oftentimes, my eye being red, or somebody who has a red eye and they're elderly or they're 40 years old, this usually occurs after age 40, and they may be walking around and they suddenly experience this severe pain, nausea, headache, or they could be in a nursing home and the nurse notices a red eye. But nobody has been trained to touch their eye, except an ophthalmologist like myself or an optometrist. And so we really want to get people at the home audience to think about a glaucoma self-exam. Just like there is a breast self-exam for breast cancer, we think this is important. Agastya, you've been to India. Tell us about what you think about the medical care and why you thought this would be useful.
Well, many regions are incredibly remote, and it's simply impossible to access good quality healthcare. So remote healthcare tools like these balls, which are extremely portable, would be amazing and would really help diagnosis.
And right now, for people with glaucoma in America, if they want to test their pressure, the machine costs $3,000 or $7,000. So some of the machines are the size of this table, and usually they're on loan from their doctor's office. Many doctors' offices do not even have that because it's very hard for a patient to stab themselves in the eye with a metal object or some protrusion and put themselves in a machine when they're all alone by themselves. So we as ophthalmologists are very worried that they will hurt themselves if we leave them some machine at home to test this. So we wanted people to feel comfortable in touching their eye and measuring that feeling of touching their eye, what it feels like, to these two glaucoma test balls. So the first one is 40 millimeters of mercury, and that's abnormal. And that would be what would happen if you had angle closure glaucoma, where you would have red eye, pain, nausea, and vomiting. And this purple ball is 20 millimeters of mercury, which is normal for adults. We're in the process of developing one for infants and children, which would be lower pressure. So ask me some questions which the home audience might have.
Okay, so I'm going to pretend to be a patient. So how would I do this? How does this work?
So I would say, Augustia, you're going to close your eyes, and with your index finger, you're going to touch your eye through the closed eyelid. And you're going to feel what it's going to feel like. It should sort of feel like the tip of your nose or like a hard-boiled egg with some sort of give. If you just touch your eye, everybody in the home audience, you can touch your eye and feel this through your eyelids closed. And then you're going to touch one of these two balls, and you're going to tell me, how does that feeling feel compared to these two balls? That sensation, the palpation of your eyeball and your touching. So here he is touching the black ball, which is 40 millimeters of mercury, and he's touching the purple one, which is calibrated at 20. And he can then tell me, well, what do you think?
Well, my eyes definitely feel a lot more like the purple one.
Well, obviously he's normal, and so we just want people in the home audience to kind of feel comfortable about this. Now, this is meant for everybody who's at home who has some concern about glaucoma. If they already had a family member who had laser for angle closure glaucoma, or laser for intermittent glaucoma, intermittent angle closure glaucoma, or if they already have glaucoma and they're under good care. Now, if you have family members with angle closure glaucoma, you never wore glasses till age 40, you're higher risk for angle closure. So we think this is very important in places like China, India, where many people are born with a smaller eye and they're more predisposed to this condition. But for people even in America, you can go to your ophthalmologist or your optometrist, have them take the pressures they usually do using the applanation tonometer, that's the blue light, and then have yourself touch your eye through the eyelid. Your doctor will then tell you what your pressure is because he just measured it, and then you will then feel how your eye measures with respect to these two balls, and you'll know, because if your eye feels like the black ball, which is 40 millimeters of mercury, that's like essentially touching the table. It has no give. It's like touching your skull, no give at all. That means if you feel that, or you think you feel that, call your eye care specialist immediately, your optometrist, your ophthalmologist. Go to the emergency room. Every emergency room in America since 1982 has passed a law for everyone taking their emergency medicine boards. They must know about angle closure glaucoma because it is a type of blindness that